Yep.
Was it
And then,
casting a shadow?
when we're all done, what'll happen
No.
is,
Okay.
then if there's no more questions, then Jen will go up and say thank you, blah, blah, blah. And then give it about 30 seconds so we can kill the live feed before you talk about, yeah.
Sounds great.
Before you mention something that you want everyone.
Sounds great.
Like I said, maybe how much you like to move it backwards, I don't know. Are we good to go?
Yeah.
Pretty soon, yes.
Welcome to the audio conferencing center.
Was that on?
Please enter a conference ID followed by pound.
Hello? Yeah.
You can talk, it's still not going up to you.
If you're the meeting organizer, press star now.
Please enter your PIN and then press pound. You are now joining the meeting.
Yeah, so I'm gonna call that number. Yep. 305-4355. Yep.
We have quite a few of these right now.
You need the ID as well. 656. 637. 164. Pound.
There's 125 views right now.
125 people watching.
Okay, well that's pretty good. To start. No pressure. For what? Okay, ranch update? Okay. School ranch update? School update? I think people get the gist.
Well,
Are we ready?
huh?
Are we ready? Ready?
Is everybody ready? Just so we have it straight, it will be Mayor Karen will come up after myself, and Jeff, and then Mike, and then Mitch, and then John, and Dr. Sen. Yes. And then when Doctor's done, then Jen will come up and close it out. If we have questions, we'll go up there as they call us up. So. Great. All right, let's go. Good afternoon. I'm Steve Rehorst, one of the public information officers with the Watertown Area COVID Task Force. Thank you for joining us. It's been a while. I think our last media briefing was the end of June, so thank you. We have a lot of people here today to talk about school updates as well as healthcare updates. So thank you for joining us. And up first, we have Mayor Karen with a community update. Thank you.
Good afternoon. Today is Thursday, August 20th, 2020. In the state of South Dakota, 53 people are currently hospitalized with COVID, and we've had 91 deaths. I don't think that number's right. Anyway, we've had a total of 191 cases in Cottington County, and 132 are recovered. That leaves 59 active cases in Cottington County, which is the highest that we have been so far. In our 9-county region, 118 cases are active, and this is also the highest number that we've had so far. Even so, our healthcare facilities are handling the load without a big problem, so we're handling it okay. We know that with school starting, the public wants to hear from the school districts, and so today's meeting will have a school focus. We also have Dr. Senna, a pulmonologist, who's here to give a healthcare perspective. Please continue to make responsible decisions.
Hello, I'm Jeff Danielson, Superintendent of the Watertown School District, with a little bit of an update on the Watertown School District. First, a couple of thank yous before we get into our return to school plans. Thanks to Reliabank for their support yesterday for our all-staff lunch. We really appreciate that. And a big thank you to Tim over at the Watertown Chamber. We just finished today at noon our new chamber luncheon, sponsored by them or organized and taken care of by them. So we appreciate all the support from our community with both of those. Another quick update. Our high school building remodel has begun, and phase 1 should be complete here before we start school next Thursday, August 27th. So we're excited about that. And then probably why we're here is to talk about our return to school plans for the Watertown School District. just an update from the last time we were here for the press briefing. In the month of June, we had a return to school task force that took place. We had 3 different meetings along with some subcommittees formed to help put together what we were looking at for our return to school plans. That group gave some recommendations that I then presented to the Watertown School Board at the July meeting. And then we moved forward notifying parents of our plans in mid-July, as well as our staff members in mid-July, with what we considered to be the plan at that time to go forward. And that included then what we did with that is we actually, through the pre-registration process we sent out with our parents, we asked how many parents would be comfortable sending back their students to come to an in-person learning. And so we had decided on an in-person return with a virtual option, and we had a very favorable response for an in-person return, with 96% of our students saying that they would be back with us in person, and that meant about 4%, so right around 150 students that would be coming or choosing a virtual option that we will be rolling out to those folks yet here before school starts. So we're appreciative of those people who helped serve on that, and also for our parents who filled out the pre-registration form, allowing us to have some data to go forward. We did take that information to our school board on at our August school board meeting with a recommendation for an in-person return. And one of the points of discussion was facial coverings and what our stance on that was. And the Watertown School District at this time is highly recommending facial coverings or masks for all students. And for our staff, we are requiring them to wear facial coverings when they are in close proximity to working in close contact with students, when they're in hallways and in common areas. The one thing I want to make clear is that is our plan as of today, August 20th, but understand that one of our main goals is we are trying to keep open as long as possible, and there may be more restrictions placed on that we would notify our parents of prior to anything taking place. But that is our goal, to try and stay open as long as we can. And we would do certain things maybe to put in a little more restriction for students and staff in order to do so. What I can see happening as we go through the year, the term I kind of use for that is rolling blackouts of different spots where there might be one certain homeroom or something like that that has a number of cases that we maybe have to have go, stay away for 2 weeks or quarantine for 2 weeks, stay out. But the rest of that school would keep going. The rest of the district would keep going. We may have something that is, throughout an individual school building that would require us then to have maybe that individual school building out for 2 weeks, depending on the number of cases and severity of them. But the rest of the district would keep going. We feel that it would probably take quite a bit for us to get to the point where the entire district would shut down. But that is obviously a possibility even within the plan. We did work on an in-person as well as a hybrid plan with an alternate schedule, so some's in-person, some at home, as well as going back to what we did in the spring, which is a virtual or online. We are, as we roll this out, the one thing we hope is that we'll get a little grace as we do this. We want to give grace as we work with families and all the certain situations that come up, but we are asking for some grace too, and maybe the benefit of the doubt when needed as we go through this. There is not a playbook for what we're doing here, and so even as these 2 other gentlemen come up to speak about their schools, we're all doing the best we can. We're all trying to make the best of the situation we're dealt with and use the information we have at our disposal to keep both our students and our staff safe. So we're excited to be back. We're excited to start school on August 27th, and we're looking forward to it. And hopefully for our parents who are watching or listening, we will be getting some more information out very soon, both from the district as well as from your school buildings, because we are changing up our open house format. That information will be coming from your buildings. We are going to more of I would call it a parent-teacher conference style format next week on Monday and Tuesday for our open houses, to help limit the amount of traffic in and out of the buildings at any one time. So that information will be coming from your buildings, as well as some general information from the district. So be on the lookout for that through our notification systems. Thank you. I'll turn it over to Mike Cartney with Lake Area Technical College.
Thank you, Dr. Danielson. Lake Area Tech remains open. We are proudly the community's workforce pipeline provider, and face-to-face is by far the best way to deliver that. This last Monday, we started our fall semester with over 2,300 students enrolled. About 1,650 of those are campus college students. We also have in there online students as well as dual credit students that make up that 2,300 students. We're using what we call a layered bubble approach, which means at the institutional level, we have the general guidance and some of the parameters just to get on campus. For example, when you enter our campus, you'll be screened and your temperature checked. But also within any of the common areas and so forth, we are requiring masks whenever you cannot guarantee that you will maintain 6 feet of physical distance. And then at the next layer down is the program level. At the program level, what we do is the programs break the students into smaller groups that stay together. They all have the same classes, and they move together throughout the day, including even when they have restroom breaks. By doing that, it allows us to make sure that we can contain any potential exposures that may come up. The other thing we do is we have everybody in assigned seatings. That assigned seating helps us to identify if somebody is positive who may have been close to them. And by doing so, that helps us with our tracking. So we have a pretty good plan in place with the State Department of Health on how to work through those types of issues. The next level is the individual level. The individual level we label your bubble, your job. And that is the basis of our entire approach, which is we give the students and the staff all the same rules and all the same responsibility. And so we expect everyone to take care of their bubble and make sure that they're exercising personal responsibility. So what we mean by that is that a bubble is either 6 feet or a physical barrier like a wall or a plexiglass shield. And if you can't do that, then you must don a mask and keep at least 4 feet. And so that's the premise that we operate under for the different bubbles. And the students are doing great. They're complying very well with it. We also issued our students masks. Every student got 2 masks, as well as staff, and hand sanitizer. And then what we do is throughout the day, we've given them all kinds of things. Today I sent out, here's some different situations you may run into, and here's some things to think about. For example, if you think you've been exposed, what should you do? Those kinds of things. So we continue to stress to our students that these are rules, information that apply not only when they're at Lake Area Tech, but when they're out in the community, when they go home, that they should be applying these rules. Because one of the great things about educational institutions is they can help to modify behavior of our young people. And we see that every day. Our students are responding as they get the information. They're taking that responsibility. Quite frankly, they're doing a great job, and mostly because they want to be on campus. They want to be face-to-face. They know it's vital to them continuing their education and getting that career, just as it's vital to South Dakota to have that workforce coming up through the pipeline ready to take on those critical jobs, such as nursing, all the healthcare fields, transportation, even our pilots. So we really are thankful to everyone that helped us put the plan together. Prairie Lakes Healthcare, Quick Care, Sanford, and Brown Clinic all chipped in. They're all helping us with our testing and information flow with our students, as well as the Watertown School Board, Superintendent, South Dakota Department of Health, and the State Board of Tech Ed have all pitched in and given us the oversight and also the latitude to make this work. Special thanks to the Governor Nome, and the South Dakota Department of Health providing us with the quick test equipment and tests so we can, when needed, do that quick testing on symptomatic students. I always like to end all my presentations now with just one quick thought, and that is just take a moment and think about the healthcare providers, our first responders, all of our elected officials, and I want to add now educators. They're all doing things that they haven't been asked to do before. They're all thinking and trying to answer questions that we've never been asked before. And so please keep them in our thoughts and prayers, and we hope for their continued success. Thank you, and at this time, I'll turn it over to Superintendent Mitch.
Thank you, Mr. Cartney. First, we'd like to thank the staff committee that from Florence that came together to come up with our plan in Florence. And then once we did that, we met twice this summer. And then we had our community volunteers take time out of their busy schedule to look that over and come up with the best plan that we had going forward. We're planning on starting school Tuesday, August 25th at 8:30 in the morning, and our school day runs from 8:30 till 3:30. We are going to implement, at least the first 9 weeks, a 4-day school week, and we will evaluate that as well as the school board each 9 weeks. So that will run Tuesday through Friday. Monday will be a day of online learning for our teachers to prepare online work for them on an online platform. And we will also work with students if and when we happen to get quarantined students. So it's important to have that day for that. We are offering 2 styles of learning, on-site and online learning. Students are utilizing both of these at this time, and I think with the fluid situation, I think students will come and go as they feel comfortable. The Florence School is doing temp checks as well as other symptom checks to kind of help on the bus, as well as when they walk into the school. In each student, elementary, middle school, high school, and staff will be given 1 mask of their choosing. Masks are highly recommended at the Florence School District. Teachers do have the option to mandate masks when students are in close contact with them. If they have a question or if they're up at their desk asking a question, the staff does have the right to mandate them. And for our staff, they are highly recommended unless they're in close contact with students, hallways, bathrooms, the lunch area, those kind of areas. At this time, school opening and closing is a local decision, and the board will work hard to keep students in the building. They've made that very clear to me and our community that students learn best in school, and they're going to do what they can to make sure that they stay there. The board and staff have done a great job on paving the way to make sure our school is safe by looking through plans. Different organizations, the Department of Health, have all chipped in and helped us to come up with the best plan to keep our students in Florence safe. We had our open house today. It ran from 11 to 7. It's currently going on right now, and it was really awesome to see kids in the building. It's been 5 months or longer than that since we've seen students in the building, and it's just a breath of fresh air. They came in smiling, had root beer floats and stuff, and normal's coming back is kind of how it feels, and we're going to continue to push to make sure that we can offer that to our students. And I appreciate all the help that we've had in the Northeast corner from superintendents and other professionals on our guidance as we move forward. And we appreciate the flexibility of the Watertown community and especially the Florence community through this process. Things are going to change, and you guys, just like us, we're going to do what we can for our students. So thank you for your time today. Next up, Superintendent John Meyer.
Good afternoon. My name is John Meyer, Superintendent with the Waverly South Shore School District. Some of the mitigation strategies that we've enacted at Waverly South Shore are very similar to some of the mitigation strategies that have been highlighted elsewhere. Just like has already been mentioned by the gentleman previous to me, we did implement a back-to-school plan using input from our school improvement team, from our Board of Education, and from our staff in general, and our community feedback. Our return to school plan, it's a 3-phase plan. Phase 1 is return to face-to-face instruction. Phase 2 is a modified face-to-face instruction blended with remote learning. We will section our student body off into 2 sections, have each section attend 2 days a week with 1 dedicated day of remote learning, with phase 3 being a full-on remote learning plan. Some of the other mitigation strategies that we've enacted at Waverly South Shore to help preserve the health and well-being of our students and staff. Similar to Florence, we are beginning our school year with a modified 4-day in-person instructional schedule with 1 day designated for remote learning. We are using a Monday, Tuesday, Thursday, Friday schedule Wednesday dedicated to that remote learning and for deep cleaning for our school district. Additional strategies, we've invested in ionized purifiers and cleaners to install in line with our HVAC system in our school. We've purchased electrostatic foggers that we'll be utilizing every evening to ionize or to electrostatically disinfect all of our facilities. Our goal, obviously, is to keep our students and staff as safe as possible, like Mr. Reed had indicated. The best learning takes place face-to-face, and our goal is to keep that face-to-face instruction happening as long as humanly possible. Along with the guidelines issued by the South Dakota High School Activities Association, the member schools of the Eastern Coteau Conference, including Waverly South Shore, Florence, we have adopted a 4-tiered attendance system at any activities that we have. Our Waverly South Shore, beginning with our opening school day of August 25th, we are opening with our Phase 1 in our instructional plan and Tier 1 in our attendance plan. Tier 1 is open attendance. If the need arises, Tiers 2 and 3 are restricted attendance. For the ECC conference, the recommendation of our schools is Tier 2, parents and student body, Tier 3, parents only, with a Tier 4, if necessary, being a no attendance at any events. In closing, I'd like to reiterate what Mayor Karen said. Strongly encourage everybody to continue making responsible decisions. We know that face-to-face instruction is the best for our students, but also the return to normalcy is critical for our students' psychological and emotional well-being. Our ability to continue with that face-to-face instruction for our students hinges on our ability as adults in our students' lives to make the responsible decisions, to encourage those responsible decisions in our children. So, reiterating Mayor Karen, strongly encourage everybody to make those responsible decisions to help protect our education. Thank you. God bless.
Dr. Senni, I'm a pulmonologist with Prairie Lakes Healthcare. Thanks for having me here today to share some of my thoughts and kind of where our feeling of where we're at as a community from a hospital and a healthcare perspective. So to kind of echo a lot of what the mayor said when we started this, cases in Cottington County and the Prairie Lakes service area are going up and are reaching levels that we haven't seen yet. The South Dakota Department of Health defines substantial community spread in Cottington County as greater than 28 cases. Obviously, we're twice that these days, so we are experiencing a lot of community spread. In Cottington County, in this area, I have some concern that might actually be an underrepresentation of the number of active cases. I have no specific knowledge available to myself that's not publicly available, but what is publicly available and publicly stated on the South Dakota Department of Health website is that only South Dakota residents are reported as positive cases in these areas. So we have Minnesota residents coming to Lake Area Technical College. We have people from other parts of the country coming to work on windmills. As stated on the South Dakota Department of Health website, those cases are not included in Cottington County or surrounding county areas. Again, I have no specific knowledge of whether any of those individuals have tested positive, but we wouldn't know if they did based on what the South Dakota Department of Health has released at this point in time. A couple of months ago, Prairie Lakes opened up antibody testing to the community. We do that testing in-house. There are also several other health organizations in this town that do antibody testing. So what I know, based on my limited knowledge of the COVID antibody testing, is that we had an overall small sample size, a small number of people compared to the number of people in the community present for this testing. It is self-selected, meaning these are people who either had a COVID test positive in the past, or many of them had symptoms and wondered if they had COVID. We didn't assess that part of it, but we do know that this is a self-selected sample and prior to antibody testing. And we are in the single digits in terms of number of people in this community who possess antibodies to COVID. We are nowhere even close to possessing, herd immunity or community immunity to COVID at this time. The virus hasn't been here to that extent based on the data that we have in front of us, which is imperfect, but the best we have at this time. Hospitalizations in this community have been consistent. Prairie Lakes is well positioned to test, triage, and treat these patients. We have not reached a point where we're worried about being overwhelmed or anything like that. We are looking at a very different picture than 3 months ago or 5 months ago when we were worried about large numbers of cases and the South Dakota Department of Health telling us that we needed to have the capability of caring for 172 plus patients. Nevertheless, we have had patients with COVID in the hospital more days than not in the past previous months, and those numbers are generally small, generally can be counted on one hand at a time, but it's persistent. It's a smolder at this point in time. Also, kind of give an update about some post-infectious syndromes that are becoming more described in the literature these days of people who get sick, the acute illness passes, and then they have a myriad of symptoms. And some of these folks have not yet returned to normal. And so there's kind of another chapter there that's we're still kind of sort of discovering. So keep that in mind as well. Where do we go from here? From my standpoint, as a community physician, as a community member, and as a father of two little boys who I'm sending back to school, we need to adjust our expectations for this winter. Everybody who's been up here has said in their own way, this is a fluid situation. We need to roll with the punches. We need to adjust our expectations of when we should go to work and when we should stay home. With the spread of influenza-like illness, sniffles, colds, those kinds of things, we should err on the side of safety and staying home and seeing where these things go. And as employers, as school administrators, as individuals, we need to all adjust our expectations. When we spread around other things than COVID, we're still spreading stuff around, and we're still causing anxiety among public, people who are getting this. We're still bogging down healthcare providers, trying to sort out what is what at this point. So in the past, when we would go to school or work with sniffles, and the people next to us might develop sniffles the next week, and that's just part of going to work and living here in February, perhaps we should readjust our expectations of when we should go to work and when we should stay back. If you are tested and you are negative, that's great, but if someone else develops these symptoms, they will have to go down the same pathway as you of being tested or staying home and figuring out what's going on. We need to keep our distance, basically, if we have any kind of symptoms until we can figure out what it is. We are well positioned at Prairie Lakes. We've obtained some new technologies, some new testing methods to help us determine if this isn't COVID, what is it? We can test for a couple of dozen popular, meaning prevalent, viruses during cold and flu season. So we can hopefully tell you what it's not and what it is at the same time. Face masks in public, I think that they're very important. It's one of the more simple and effective tools that we have in order to try to combat this. And my personal opinion is that it's just part of being a good citizen and protecting our friends, our family, the people who we live and work with in these communities. And I think that those masks need to adhere to CDC and South Dakota Department of Health standards, which is multi-layer, at least 2 layers of cotton when speaking about fabric face masks. So that's what I have to say about what I see going on in this community at this time regarding where COVID is now, where it perhaps has been, how our organization Prairie Lakes is responding to it, and what I think we should try to adjust our expectations regarding going through this winter. Thank you.
Thank you, everyone, for all of your presentations. Do we have any questions from the media?
Okay. Dan Christopher from Watertown Public Opinion. Question from Mayor Sarah Karen.
Perfect.
Hi, Mayor. Basically, you wrote a story, if you recall, back at the end of June about how if the numbers shot up substantially, you may consider measures such as mandatory face masks. Obviously, we do have substantial community spread according to the Department of Health. Are you thinking about that measure or any other kind of restrictive measures like that too? Yeah.
Well, as Dr. Senna said, it's an effective tool. At this time, we're not talking about any mask mandate, but I'm not going to rule that out for the future. And what I would look at is the numbers that are actually needing hospitalization, not just who has it. Because if you have COVID and you don't have symptoms that are dangerous to your health, if you can just isolate yourself and get better, fine, do that. And if our hospital ends up to the point where they don't have enough room, that's when we start talking about doing different things, like maybe a mask mandate. So not at this time, not ruling it out for the future.
All right, sounds good, thank you.
Yep.
And then question for Dr. Danielson. Obviously, you gave a thorough presentation about the just the measures school districts taking place, and I just want to bring up one more thing. Apparently, a colleague of mine saw on Facebook that parents are kind of worried about how the morning drop-offs and afternoon pickups, if that will be, I guess, if there will be any delays or anything like that.
Sure. What we're asking, so what we're trying to do in the mornings is to limit the gatherings. So I know that there was some messaging that maybe went out from individual schools that said, don't bring your children till 8:25. That was not what the message was supposed to read. Our buildings will still be open starting at 8 o'clock so that hopefully that people can drop off between 8 and 8:30 to still have their normal pickup and drop off. Same thing with the busing. So I think there was some early communication that went out that maybe gave the appearance that that's what we were thinking, was that people did not need to arrive, that we were asking them not to bring anybody till 8:25, but that was not the intent of the message. The same times are still available, but people do need to know that if they are able to wait until later to limit congregating and gathering of students at any of the schools, that would be appreciated. But we also understand work schedules and that kind of thing, and people still need to get to work by 8. So that is still available in the same manner as previously. So, and breakfast is still being offered at all sites.
All right, thank you.
All right, are there any other questions from the media? No? All right, Captain Rehorse and myself, Jennifer Bender, the public information officers with the task force, thank you for joining us today. We might be back, so stay tuned for updates on any community spread or information on COVID. Thank you.